The next call is a split call. Denise Roche, 5 minutes.
Thank you, Mr Speaker. I rise to take a short call for the Greens. Sir, you've heard from my colleague David Clinton earlier that we will be supporting this bill. Initially, sir, we did have some concerns around the whole issue of compulsory treatment. But on balance, and having gone through the Select Committee process and looked at the changes that were made and also at the reassurances that came through, the bill that as it stands at the moment is a much better piece of legislation than the original 1966 outdated Act. Sir, I read through some of, I wasn't on the Select Committee, but I did read through some of the submissions, and I want to carry on with the theme that was raised by Ria Bond, which is actually about what are the services that are currently provided for people who would be under a compulsory substance abuse treatment order. And what we heard from the Capital Coast DHB in their submission, they put it really quite eloquently when they said that current treatment is there are mental health providers and clinics and centres, which is sometimes for people who are under compulsory orders, but that is specifically for mental health issues. And then there are residential treatment centres for people with addiction issues, but those are for patients or clients with substance abuse problems who are actually undergoing that treatment willingly. So where do you treat the people who will be under a compulsory order who aren't actually that willing in the first place? Where do you put them? And the point that my colleague in New Zealand First made was that we have a system, a mental health system, that is frequently shored up by the not-for-profit sector, but which is woefully underfunded. And in fact, the entire health system has been underfunded cumulatively over the last 8 years of this government. So, sir, the question is, where do we put people? And then there is also the concern about how many clients there will be. How many people will be under a compulsory treatment order? And the reason we should be concerned about that, sir, is because of the pee epidemic. Now, the Greens were privileged to be at Te Tii Marae on the day before Waitangi Day, and to be in their whare when the hikoi, the march of the community people who were marching against pee in their communities, came through the pōwhiri and into the whare and talked and put their take on the floor. And the concerns they have, sir, is that there is a scarcity of treatment options available. And when you consider, sir, that even the Salvation Army in their State of the Nation report last week are saying that pee is the scourge in our communities, that it's basically wiping out entire communities and families and having a huge impact, but a generational problem, and we're not seeing access and appropriate access to treatment either. And when you consider, sir, that Māori are more impacted in this kind of area, and there are some statistics anyway, which say that from 2015, a report showed that amphetamine and cannabis use was much, much higher, disproportionately in the Māori population, similarly with hazardous drinkers, and that Māori made up 35.3% of all people seen by alcohol and drug addiction teams, while being 15% of the population. So, sir, we have to wonder, will there be services that are culturally appropriate? Will there be services that are actually focused on prevention? Because that is the cheapest option, and that is the thing that's best for our families and communities. But, sir, that takes investment, and I challenge this government to invest in our communities, particularly in the regions. Thank you.